let's wrap it and start. It's me, Lily, and we have the beautiful Eda, my colleague, the amazing, the sweet, lovely. When is it done? Like, how can a patient do it? Is it necessary? Is it not? Can a patient do?
Patient who comes from all around the world, you can contact with Lily.
So the first thing is we're gonna talk about, right, all about health, but more different, right? Because we are going to have a conversation, you know, related to obesity part, but also plastic.
Yes, sure.
So because as you may know, when our patients, they come here, first of all, on the obesity side, they do have weight loss treatments done, and then after that they go back to their country. Now, what Eda does is that she deals with patients related to the plastic side. So of course, we do have patients that come directly for plastic treatments.
Yeah, sure.
But most of the time we have patients that come after having their weight loss treatment done.
Yes.
So we're gonna have a conversation about that. When is it done? Like, how can a patient do it? Is it necessary? Is it not? Can a patient do just obesity without plastic? Can a patient just go for plastic without the weight loss treatment? So let's wrap it and start.
Yes, like first we're going to, you know, talk about the correlation between the weight loss and the plastic operations.
Yeah.
Actually, Lily may know a lot. She has many patients who comes from all around the world, and the weight loss about, like, for example, mostly around what, 50 kgs, 60 kgs. It really depends on the person. But when you lose that kind of weight, of course, your body just like sagging, and any part of your body can sag, like your arms, your breasts, and your thighs, in any area. So sometimes you can't deal with the, actually not sometimes, mostly times, you cannot really handle the whole process with the sports or dieting, because there are so many extras to in. So that's why you need to have the plastic surgeries.
Yeah, correct. And so the thing is, let's start with the obesity part, right?
Yes.
As you guys know, because we've had many videos, and even with our podcast, we had discussions about it. So you guys know that when you do want to have a weight loss treatment surgery, first you get in contact with us, or I mean international patient coordinators, and then all the information needed will be sent, and then you'll receive everything, you will book your treatment, and then you'll come here, and so you'll have the surgery. And so the thing is, when the patient comes, right, the patient has either a gastric sleeve or gastric bypass, or even some other weight loss treatment, because there are many.
Yeah, sure.
And so it depends. If it's, for instance, let's just stick with bariatric treatment, for instance, which takes about a year after the patient has lost, like, the average, like the 40 kg.
The optimal time for losing weight, actually.
Like the 40, 50 kg depending.
Yeah.
And so after that, the patient can continue with, like, just a healthy way of living and everything like that.
Yes.
Now, we do have patients that, you know, after having their surgeries, they have, like, the loose skin, correct?
Yes, sure.
So what happened is that that patient will have, like, the loose skin, and then the patient will need to have some, like, what the plastic team call, they do have that, and then they can come here, and so they need, like, another process for the plastic.
Sure,
right?
Another surgical process to reach their best version with their body, actually.
Yeah.
You know, after the bariatric surgeries, you may have time for losing weight, at least even, I think, 6 months to a year.
Yeah.
So right after this process, if you think like, yes, my weight loss has stopped, I am following the strict diet and just, you know, making sports, but I have sagging skin. So, like, when should I have the plastic surgeries? I think this is the most common question that I take from my patients. The exact timing is after 6 months. If you say like, yes, it has stopped and now I can, you know, sometimes you lose weight, but if you keep going to lose weight, this means there can be more sagging skin too.
Yeah.
So when you say, yes, it has stopped, now I'm ready to have the plastic surgery, and then you can contact with us to learn more about this process, actually.
Yeah.
So after you're reaching us, we just, like, it's similar to the gastric sleeve or gastric bypass, any kind of bariatric operations. We just want you from the photos for the consultation, which is made with the doctor. So after the consultation, we're just, like, offering you the packages and, you know, informing you about the whole process, the hotel, hospital, and the, you know, transfer services. And exactly based on your needs, our doctors suggest you some treatment plans.
Yeah.
Mostly it can be like a mommy makeover, which includes the tummy tuck, which is the most popular one, and also 360 liposuction, and mostly the breast operations, like with implants or without implants. Our general aim is to solve the sagging skin, actually, and contour the body. Sometimes the patients can, you know, mix those plastic operations are also the weight loss option, for example, with the liposuction. But no, just all the plastic operations are for the body contouring. They're not weight loss options.
Okay,
right?
so that was what I also wanted to ask you, because just a few minutes ago we've mentioned the mummy makeover, right?
Yes.
So my question is, do all patients after their bariatric surgeries, for instance, do they all need to do specifically the mummy makeover? And also, since I'm asking that, can you kind of like just briefly explain what mummy makeover is?
Okay, of course, each patient has unique needs, like the bariatric surgery, because some patients with the sagging skin are generally on the breasts, or some patients are on the thighs, and some of them for the arms. So we cannot directly give to the patient for the same treatment plan. Mummy makeover is a combined procedure which can include the breast, tummy, and any kind of sagging skin areas actually. But we just like suggest the patients to, after the consultation, like sometimes with video calls or sometimes with only photographs, it will be enough. And also before the surgery, when you're coming to Turkey, you make face-to-face consultation with the doctor right before the operation too. So we don't suggest the patients at the, every time, every typical kind of procedure. It depends on your situation and also your requests. For example, sometimes patients has really, big sagging skin on the tummies, but they feel okay with that. And they, it's not really an issue for them, but they just like want the breast implants or sagging breasts for the breast lift. So it's really hard to say breasts, right?
Breast.
Okay. And sometimes, we just like make the plan according to their suggestion and the request. So they're not all typical and the same for each patient.
Okay, got it. So now I do have a patient, for instance, right? The patient, let's say first, because for men and women, it can be different also.
Yeah, sure. Their needs.
So I do have my patient. She's a female. She has done her gastric sleeve surgery and now she wants to come back here to have, let's say, the mummy makeover. Okay. So first thing first, how can that patient reach out to you?
If you, need any information about plastic surgeries, you can contact with Lyly, and probably we're just like forwarding the messages and the numbers between us.
Okay.
So after you switch to the aesthetic department, plastic department, probably we're going to first of all make you understand what are we exactly doing, and afterwards we just like want you the photos for the consultation. We're just sharing a guideline and you're following that guideline and filling some medical forms, and then we forward that knowledges to the doctor. And after the doctor, she gives suggestions, and then we plan your treatment with the financially and the whole process, and then we came back with you a brand new treatment plan.
Okay, so basically kind of like similar when it comes to bariatric treatment too.
Yes.
So do they need to stay here longer though compared to bariatric surgery? Because for bariatric surgery, it's usually 7 days, like 8 days, 7 nights. But with plastic surgery, do they need to stay here for like a whole week also?
Okay, it's just sometimes just less than the bariatric ones. For example, if for the breast, it's probably going to take like 5 or 6 days.
Okay.
But for the whole kind of mummy makeover procedures, like combined issues, yes, it's similar, like 7 days and not 8. I haven't been, give a treatment plan with the 8 days. It's mostly 7 days, we can say.
Okay, got it. Now, with plastic surgeries, because for gastric sleeve, patient don't need to come 1 or 2 times.
Yes.
But for instance, if the patient has lost over like 100 kg.
Yes.
So does this patient
Too many issues.
need to come here just during like
first session,
first session or like more sessions?
Yes.
How can it happen? Like, do they need to have just 1 session or they can have more sessions?
Yes. As for the whole, I think, Dr. HE Clinic team, your health is our priority. Sometimes, maybe the patients are asking that, can it be in 1 session? I don't want it to come for twice. I don't want it to, I just wanted to make them whole at once and then go back. It's not sometimes fully healthier to make the whole operation in just 1 session. For example, if you're also interested in the thighs, arms, and also the other kind of body places, probably we just like separate it into 2 different sessions, because when the whole procedures are being done in the same time, of course the operating room hours are getting longer and longer, and you're in the anesthesia, so that's why it's not really helpful, of course, for the healing process. So you need 2 times mostly. And if you're interested in the thigh procedures or just like arm procedures with the also tummy tuck issues, like mommy makeover, we're probably going to separate it. Of course, we're just like listening to our patients and asking their requests, but as I mentioned, your health is our priority, and we just like suggest you the best option for your body.
Okay. So also with plastic treatments, is there any limit? Because for us, for instance, the patient needs to have at least for bariatric surgery 35 BMI for males and 32 for females.
Yeah.
Now with plastic surgery, is it the similar thing, or like all different type of BMI can, I mean, patients can have their plastic surgery done?
Actually, yes. It's a sad news for the patients, but yes. As I mentioned, the whole plastic and aesthetic operations are not a kind of weight loss operations.
Okay.
You have to be under a certain BMI, mostly for the women's it's just like 32, because if you have a really fat tissue, so this means to make an operation on you is risky.
Okay.
Because as I mentioned, for the anesthetic issues. So that's why you have to be like below 32 BMI, aroundly. Actually, like we're going to make a consultation, but mostly this is what I can say.
Okay.
And yes, we're caring about your body and height also for the plastic operations too.
Okay, so there's still a need, sorry, for like a specific information regarding the height and the weight of the patients. Okay.
If not, we're just like suggesting the patients to lose a bit more weight. For example, we can contact with you, and sometimes even we have the patients, for example, they make the booking for the after 6 months, and we want them to lose weight before coming to the operation. They just like set up their mind and wanted to have the plastic operations and booking their dates, but they just like really need to lose a little more.
Okay.
So we're just like supporting them actually, and then come back after Turkey. They're really ready to have the operation.
Okay.